So a reverse shoulder replacement is a replacement just like any other joint in the knee or hip or in the shoulder, but instead of having the components in more of an anatomic position, you're reversing the ball in the socket. So the ball is on the socket side and now the socket's on the ball side. And so it's a little more constrained, but it puts the shoulder in a better mechanical advantage. For those patients that have irreparable rotator cuff tears or really severe arthritis where a standard shoulder replacement can't be used, it can be a really good alternative. So the best patients for reverse toe shoulder replacement are those patients that have rotator cuff tears that are irreparable, meaning they're not going to be able to be repaired by standard means. This is generally going to be your older patients, usually mostly above 65 and older. It also can be used for fractures where it's a really severe fracture of the proximal humerus, or just in severe arthritis cases where a standard shoulder replacement's not going to get enough fixation. So the design of a reverse shoulder replacement is to basically put the deltoid muscle, which is your big muscle of the shoulder, which powers the shoulder, on tension by bringing the shoulder back down a little bit lower so that you'll have more tension on that muscle to use it to then be able to power the shoulder to lift it instead of using your rotator cuff muscles, which you would use normally. So in terms of the process of someone that's going to undergo reverse total shoulder replacement, it's a surgery where generally most patients can go home the same day. It takes about an hour to do. Patients are going to use a sling 2 weeks all the time and then start coming out of it at home. We start physical therapy generally around 6 weeks to work on range of motion, and then eventually we do strength at about 10 to 12 weeks, and the total recovery is somewhere around usually about 4 or 5 months. So if you're having shoulder pain, you can give us a call or go to our website and make an appointment, and I'd be happy to meet you.